Hello and welcome to this new podcast of the American Journal of Public Health. This is one of our series, What is Public Health, in which we interview people who play, major role in public health and explain to us, what's their life, what's their role, what's their function, and how, this role can be affected by the current state of politics in this country. So today, with my good friend and always, co-host of this podcast, Vickie Mays. Hey, Vickie. And we are receiving Professor Sonja Rasmussen. So Professor Rasmussen is at the Johns Hopkins University School of Medicine, but she has been for many years the editor-in-chief of the journal of the CDC called MMWR, Morbidity and Mortality Weekly Report. So Sonja, welcome.
Thank you. I'm glad to be here.
Please tell us, what was your life when you were an editor of MMWR? What was your function, role, obviously your importance in public health?
Yeah, MMWR is seen as the voice of CDC. It really is a way to get public health information out to a broad range of people. And I think we did a good job at that. There were more than 147,000 subscribers. It's a free journal. And there were more than 17 million page views a year. So we had a lot of people that looked at the reports from MMWR. It was really the way to get out critical information in public health, whether it was about more of a routine sort of issue, something about new data about chronic disease. And some of those data were from CDC, some were from state and local public health departments. Our goal was really to get that information out there, not just getting what the recommendations were, but to give the data behind those recommendations.
So give us some examples that stand out during your tenure.
The time that I was editor-in-chief, the thing that we worked on the most was Zika. It was the time of the Zika outbreak. Early on, it was primarily in Brazil. And so we were reporting on the cases in Brazil. Then we started reporting on what was new methods of transmission, about learning about transmission through semen, learning about transmission to babies. But at that point, we really didn't know for sure if Zika virus caused birth defects or not. Then we published a lot of information about guidelines, and those guidelines kept changing. As we learned more information, we changed the guidelines. The CDC changed guidelines of how should pregnant persons who are infected with Zika be cared for. And then we also developed guidelines for the infants born to those mothers.
Yeah, and that was a huge scare for those who remember. And we published also in AJPH an issue about that with a lot of Brazilian data.
Let me just make a comment about MMWR as a user, because I think that what is so important is that it will very quickly address the change in the science. And when you're in the field, you need that. It also will address misinformation. People start out with, this is how we thought. And then very quickly, as you learn things, you put it out there. And as a person working, as a researcher, as a clinician, it is so critical. So I've always been like a big consumer of MMWR, which is why I was so upset when the recent one was delayed in coming out, because I live in California and it was going to be on bird flu and, in close proximity. So I think people have to really appreciate that this is how we protect ourselves, is by the ability to get science quickly, and as it changes, to update it. And as a scientific evidence for how to prevent it, MMWR does a great job.
Yeah, I think that's the most important thing, is to get not only, okay, we've changed our mind, we have new information, but these are the data that back up why we changed our mind. Yes. And that's where I feel like MMWR plays a role. CDC, of course, could distribute the information about new recommendations in other ways, but MMWR gives the chance to have those tables, have those figures, show the data that is typically collected by state and local health departments, show those data, and why, what's the underlying justification for why the recommendations have changed?
So what should we expect about what's going on? Because as Vickie just said, the MMWR doesn't publish as it used to.
I'm concerned about it being politicized. I'm hoping that things are going to be getting back to normal, but there were, as Vickie said, 2 weeks where the publication didn't come out at all. In its over 60-year history, that's the first time that scheduled issues didn't come out. Even during previous government shutdowns, truncated issue, a shorter issue came out, a slimmed down issue came out with critical information. And for those 2 weeks, there was nothing, which I think a lot of us felt like, how could the MMWR not come out 1 week?
Yeah.
And then when it restarted, it started with not full issues. The next 2 issues were very truncated issues, and at least for what was reported in the press, there were bird flu articles that weren't coming out. And of course, that's what we all wanted to know about. And then instead, there were some notes from the field, very short articles. So not giving us the information that we wanted, especially when at least what we had heard was those bird flu articles were ready to come out. So I think that made a real concern about what's going on and why are we not hearing the information that we need to hear. And I think one of the most important things, and I served under a Democratic administration and a Republican administration, and I've talked with the other editors-in-chief of MMWR, never before has there been politicization of MMWR. MMWR has been the straight information. It's been a place you could go to for scientific data without being biased. And I am really concerned about the possibility of politicization, because I think if that happens, the credibility of MMWR will be at risk. We need people to be able to have a place that they can get, a place that they can trust, a place that they can say, this is where I can get straight data and straight recommendations from the experts without it being biased by politics.
Yeah. And then, I mean, I recall that in 1981, I mean, MMWR was the first to report cases of a Kaposi and pneumocystis carinii, I mean, the whole HIV epidemic. And now we have an outbreak of measles, apparently very serious, with already 1 child dead in Texas. So isn't it also somewhere where MMWR would have contributed the information that we need?
Yes, and I think that's a thing. The thing I learned from my 20 years being at CDC is there's always something going on in public health. There's always something to be aware of, always something to be concerned about, and MMWR is where it's published. And as you say, there's an outbreak of measles in Texas, and then now moving into neighboring states. There's a tuberculosis outbreak in Kansas. There are spreading H5N1 outbreaks in animals and limited to people. We need to know about this information, and so that we all can be prepared. So I'm concerned about not having those data from MMWR being available.
Yeah, one of the things that's so different is that what MMWR did is it gave the media the information to be able to spread it to quickly. So if you look at what's going on with the measles, they're really like speculating much more, and that's not what we need.
Yeah.
What we really need is a definitive source. Instead, they're asking questions and they're pondering, could it be this or could it be that? That's actually not good for public health right now, is that when the people who are actually getting it to the public don't have like that definitive data. So they start interviewing people, sometimes not the best, to try and answer questions that would have been presented in MMWR.
Exactly. I think you're exactly right. I felt like when I was editor-in-chief, one of the biggest things we tried to do is to get the information in a manner that the media could understand it and help us disseminate that information to the public. So it wasn't just for medical and public health professionals. Of course, that was a main audience for us, but we also wanted to be sure it was short, succinct articles that anybody could read and that the media could help disseminate to the general public. Because that makes us all safer. If people know what's going on in public health, they can all decide what kind of protection they need to make.
And this is very important. I have one last question, Sonja. I mean, what's the relationship between MMWR and NCHS and all the national surveys? Because this data seems to have some surveys have been abandoned. Like, so for example, PRAMS, the pregnancy risk assessment survey, has been stopped, and we don't know about other surveys, and Haynes, etc. So what was the connection between those surveys and MMWR?
Yeah, MMWR served as a way for them to get their information out. There were articles that were written from NCHS that would be published in the MMWR. So we helped to disseminate that information that had been collected using taxpayer dollars and got that information out to the public.
What do you think is the impact? If you could kind of predict, because sometimes things that are happening now, we feel it later. So what do you think is going to be the impact of the slowing of this public health information going out? Like, like we just said, we have measles, we have tuberculosis. What's your prediction of what the impact's going to be?
Yeah, I think one of the things is that we won't be as prepared. I
Yeah.
think that's my biggest concern. And I think people think that we always know at the time that the article's published how important it's going to be. That's not always the case. And the editor-in-chief in charge at the time of the first cases of AIDS said that he wasn't even sure if he should publish it.
Yeah.
So you don't always know when you get that article if this is really something that's important or not, and think how important that ended up being in helping us to understand this really worldwide pandemic, the pandemic that was going on of HIV. So I think we won't be as prepared. We also aren't getting recommendations out. And I keep seeing on my social media people asking, should I get vaccinated? Should I get another vaccine for MMR to protect myself from measles? I haven't had one for a long time. I think that's really a loss right now of having that ability for MMWR to get that information out about what are the recommendations right now for people, for children who aren't vaccinated, 6 months of age or older is a possibility of getting vaccinated. Who should get vaccinated early in this time of a significant measles outbreak in Texas and New Mexico?
Sonja, thank you very much. I mean, thank you for all you do for public health, and you did, and I'm sure that with this interview, you've clarified the importance of this journal, who maybe works in the background, but it's so important for everything that we see and we follow, and the recommendation and how everything about public health is disseminated. Thank you, Sonja.
Yeah, thank you.
Thank you.